Good morning, Mr. Williams. I'm Dr. Peter. How are you doing today?
Good morning, Dr. Peter. Nice to meet you. I'm doing all right, thank you.
I see you're here to discuss your osteoarthritis. Could you tell me a bit about your background and what brings you in today?
Sure. I'm originally from Melbourne, Australia, but I've been living here in the US for the past 5 years. I work as a software engineer, which means I spend a lot of time sitting at a desk. I've been struggling with osteoarthritis for a few years now, and lately, the pain has been getting worse. It's becoming harder to manage, and I need some advice on what to do next.
I understand. How long have you been experiencing symptoms and what difficulties are you facing because of the osteoarthritis?
The symptoms started about 5 years ago with occasional pain in my knees, but over the last year, it's progressed to my hands and hips as well. The pain is particularly bad in the mornings and after I've been sitting for a long time. It's making it difficult to type and even walk sometimes. My job requires a lot of typing, and it's becoming increasingly hard to keep up with work.
That sounds challenging. Have you tried any treatments or medication so far to manage the pain?
Yes, I've been taking over-the-counter painkillers like ibuprofen, but they don't seem to be working as well anymore. I also tried physical therapy for a while, which helped a bit with my mobility, but the pain is still there.
I see. Can you tell me about your medical history? Any other conditions we should be aware of?
Besides the osteoarthritis, I have high blood pressure, which is managed with medication. I don't have any other major health issues.
And what about your family history? Is there a history of osteoarthritis or other joint-related issues in your family?
Yes, my mother had osteoarthritis, and my father had rheumatoid arthritis. It seems to run in the family.
That's important to note. Are you currently taking any other medications besides the over-the-counter painkillers and your blood pressure medication?
No, just those.
Do you have any allergies that we should be aware of?
I'm allergic to penicillin.
Thank you for that information. And based on what you have described, it sounds like your osteoarthritis is progressing. I'd like to perform a physical examination and possibly order some imaging tests to get a better look at the affected joints. Have you had any X-rays or MRIs done recently?
No, the last X-ray I had was about 3 years ago.
All right, I think it's a good idea to get some updated X-rays and possibly an MRI, especially since the pain has been spreading to other joints. These tests will help us understand the extent of the arthritis and guide us in creating a treatment plan.
That makes sense. What kind of treatment options are available?
Well, there are several options we can consider. Since the over-the-counter painkillers aren't providing enough relief, we might look into prescription medications like stronger non-steroidal anti-inflammatory drug or possibly corticosteroid injections. Additionally, continuing physical therapy could help maintain your joint function. In some cases, we might also discuss surgical options, but that's usually a last resort.
I see. I'm open to trying new treatments if it means managing the pain better.
That's a good attitude to have. For now, let's start with the imaging tests. I'll refer you for the X-rays and MRI. Once we have the results, we can discuss the best treatment plan for you. How does that sound?
That sounds like a plan. Thank you, Dr. Peter.
You're welcome, Mr. Williams. I'll have my assistant schedule the tests for you. We'll follow up once we have the results, and we can go from there. Take care and see you soon.
Thank you, Dr. Peter. I appreciate your help.